Welcome to the third global virtual town hall to save lives and livelihoods. Thanks to our partner CG for providing the staff and technical prowess to make these town hall meetings possible. I also want to thank the 90 members or 90 plus members of the International Planning Committee, the co-chairs of the working groups, and the 181 members of the 5 working groups from 96 countries who produced the reports and recommendations you will hear about today. Finally, I want to thank the Lauder family and especially Ambassador Lauder for their support for the Think Tanks and Civil Societies program and this extraordinary example of international cooperation. One final personal note before we begin the program. There are 2 people in the audience today who made a difference in my life that I wanted to recognize. One is Don Cooney, who as a young priest taught me the importance of ideals, critical thinking, and action. And the second is Anita Summers, who mentored me as a young scholar and taught me that ideas, think tanks, and public policy matter and can make a big difference in people's lives. We have all been influenced, stymied by the unprecedented speed, magnitude, disruptions, and a sustained uncertainty of the COVID crisis. And I would suggest that we are now entering for a sustained period, the era of uncertainty. That's the dark side. But consider the fact that in a time when international cooperation is being maligned and nationalism and extremism are on the rise, thousands of policymakers, think tank scholars, and executive have crossed borders and party lines to come together in a series of global town hall meetings to respond to this crisis. The fact that close to 600 people are here today and close to 200 people came together to produce 5 evidence-based, action-oriented reports in just 30 days is truly extraordinary and a beacon of hope in these dark times. International cooperation is alive and well. A quick overview in terms of where we have been. Over the last, since April 7th, we have held 3 town hall meetings, or will have held 3 at the close of this meeting. And at the beginning of the COVID crisis, I felt that think tanks around the world had a duty to respond to the crisis for 2 reasons. One, because the world needs our ideas and insights if we are to beat this beast. And 2, because think tanks need to demonstrate that think tanks and evidence matter and can really make a difference, especially in times of crisis. It was with this in mind that I proposed the global virtual town hall meeting on April 7th. 375 think tank executives and scholars from 163 countries and 163 think tanks and 86 countries came together to discuss how we might deal with the crisis and how each country and institution was dealing with the crisis. There was a tremendous show of solidarity, but many were looking for answers. And with that in mind, we moved to have a second town hall, which took place on May 13th. A large group of think tanks came together during that time, and 5 working groups were formed to develop rapid response, evidence-based, action-oriented policies and programs to respond to the crisis and the economic and social fallout that might follow. Today, we will hear the highlights and key recommendations of the 5 working groups, as well as a group of thought leaders and policymakers who will speak to the impact of the crisis and what lies ahead, and a group of policymakers who will share how we can move from ideas to action and implementation of the policies and programs proposed by the 5 working groups. Our hope is that everyone here today will join one of the 5 briefing and engagement sessions that will be held July 6th through the 10th. I now want to introduce Carlos Savan from the Vitilio Vargas Foundation, who will say a few words of welcome. Carlos Savan.
Good morning, good afternoon, or good evening, depending where you are. It's a pleasure to be here today at this meeting, promoted once again by a formidable, let me say, Jim McGann, a very good friend, but not only that, the real promoter of this think tank world as we know it today. As Jim said, we are going through a very deep crisis, a crisis that I presume no one here ever has faced before. And we really don't know what to do we? Because a crisis is not only a sanitary crisis, it's also a crisis of change of model. Digitalization has accelerated. This is going to have profound impacts in the world economy. This will have profound impacts in geopolitics and so forth. So at this time, more than ever, think tanks are necessary. Think tanks will have to bring back rationality in a world that tends to be much more irrational than before, where things have become much more dangerous. Not only rationality, think tanks have to bring back bona fide in human relations. Think tanks have to push forward for more conversation, for more understanding. And I think that this type of initiative promoted by Jim's Center at Penn University is very important, extremely important. So it is a pleasure to be here today to participate in this event. And I would like to not only to congratulate you all for participating, but also for congratulating Jim on his tireless efforts. Thank you very much, Jim.
Thank you, Carlos, for your very kind words. I now want to have a few words of welcome from Rohinton Mahora, our partner and good friend from CG in Canada. Rohinton.
Jim, thank you. And let me echo what's been said already, which is that this COVID-19 situation is the proverbial crisis and opportunity in a number of ways. I think it has shown the importance of evidence and science. It has shown the importance of leadership. It has shown the importance of cooperation and social cohesion. And so when this series was still a gleam in our eye, I recall having discussions with colleagues about how think tanks can come to the fore and actually practice what we preach. We expect governments and others to cooperate and to be scientific and to be rigorous and credible. And this is something we have always espoused and for the most part practiced. But this crisis provides that opportunity in ways that we've never seen before. And so not only do we have to see ourselves through the crisis, but then imagine what kind of world we want to live in beyond the crisis. And this is where I think the real opportunities lie. A cleaner world, a fairer world, a more open world. And these are the ideals that most of us have signed on to. And thanks to the work of all of you, and especially the 5 working groups and Jim McGann's stewardship, we're at a stage where we can make these things happen in ways that have not been able to happen, at least in our lifetimes. So this is a golden opportunity for us to advance exactly the network and the globalized thinking that was probably Jim's motivation 10, 15 years ago when he began the network. And I'm very pleased to be a part of it and look forward to reading the reports more carefully and the rest of this session. So back to you, Jim.
Okay. We will now hear from Adam Posen, the president of the Peterson Institute for International Economics, about the daunting economic, both domestic and international challenges we face. Adam.
Thank you, Jim. Thanks to you and the Think Tanks and Civil Society program, as well as to Rohinton and the team at CG for making this event and all that goes around it and with it possible. My goal is to just contribute something of an economic baseline thematic for people to play off of. This is a very diverse group of think tanks, a very diverse world we live in. Economics is secondary to many concerns of human rights and certainly with the disease, but it is an important secondary factor in the sense that it comes next causally in the transmission of the disease's effects to society in terms of human welfare and policy concerns. So I want to just start by unfortunately assuring people that the situation is grim and it is driven by the disease. There is a huge divergence, obviously, between China and Western Europe and certain other countries in East Asia, notably Taiwan, South Korea, Japan, who have managed their disease well from a public health perspective, and the US, the UK, and Brazil and Mexico, who have mismanaged their disease from a public health perspective. The economic differences are quite wide. And I want to emphasize that this isn't a question of the specific dating of the lockdown, as some would have it. It's simply, sadly, about how much reassurance you give people that things are not going to get worse, that uncertainty is rising. The basic economic instinct of people is to adapt, but they will only adapt when they're confident that things are not going to be better if they wait, better if they hold off. And this is what we're seeing now in the US, where states, not just governments, but people are pulling back, realizing mistakes have been made, realizing that they're more exposed. And so in terms of economic bottom line, that means that we are seeing strong recoveries in China, in East Asia, in Western Europe, in Eastern Europe, and we should believe these recoveries. They are for real. The US and UK recoveries are delayed, but still coming. And if the people react and the government reacts to their reaction, this is the kind of feedback from facts that Rohinton and Jim were talking about that think tanks can help. That will speed the recovery. The critical questions that remain are the extent to which you close the gap from before. And this is very dependent, not just on public health, but on how much our economies fundamentally change and how quickly we change. There is the direct idea of restructuring, that there will be thousands, if not millions, of small businesses around the world, businesses in exposed industries like hospitality and tourism and small level retail that will have to change and shrink. But there's also all these positive sides of potential adaptation to the green economy, to a more humane economy, to work from home, and the businesses and opportunities that come out of that as well. And so it will be a test for different countries on their flexibility of how fast they're able to adapt and how much of their economy they're able to reallocate. And this is a difficult question because you wish to be kind and understanding to people who are put out of business through no fault of their own, but you still need to make people get out of sectors that are shrinking and move into new sectors, both capital and most importantly, labor. Think of this as analogous to New Orleans after the floods and the hurricanes, that you want to help people rebuild, but you also don't necessarily want to rebuild all of New Orleans on the floodplain. The same thing is going to have to, time of decisions will have to be made. Looking more globally, this has been, of course, a crisis for many developing countries and emerging markets. It is very difficult to sort out at present what is going on. The first and most notable point as my colleague Penny Goldberg has pointed out recently, is that the death rate in the developing world has been far, far less than we feared so far based on existing data, and far, far less than in the richer countries that have messed up. And this is partly, it seems, due to demographic differences and health differences, and partly because a lot of preconceived notions about governance and quality of governance don't hold. That countries in Africa, in South Asia, to a lesser degree in Latin America, have been able to perform in ways dealing with the pandemic that rich countries have not. But it's still early days, and we see the struggles in India, and we see the self-imposed struggles in Mexico and Brazil that are going to make it very challenging and very deadly. There are a few themes that I would just emphasize have come out that will be reinforced by the pandemic. Secular stagnation, the slowdown of growth and productivity growth, and the lack of appetite for private investment, the higher risk aversion, this whole bundle first identified by Larry Summers is, if anything, deepened and strengthened by the crisis. And so there is more room for public investment, ironically, as Olivier Blanchard has pointed out, from persistent low interest rates, but there is this ongoing stagnation in the rich world. We also know that income inequality is going to rise, and even if it's not income per se, it is going to be the inequality of people who are forced to go out on the front lines to earn a living, whether it's in Delhi or New York, versus the people who are, like us on this call, able to work from home in our virtual backgrounds. We know that the US, China, and the broader China, rest of world tensions in the economic sphere have gotten worse, and we know this is hurting people. This is not just questions of protectionism in the usual sense. We saw the tit for tat leading to even the EU restricting medical exports. We see uncertainty over the questions of vaccine, intellectual property, and distribution. This is a critical area for international cooperation, and it is one where international cooperation should be achievable. And this is where I think a lot of our work at Peterson has gone in recent weeks and months. And I think this group, I know the working groups are considering these issues. The scope for policy, public policy, which we hope to influence to restore the status quo ante, is limited. No matter how much monetary or even fiscal policy does, there are fundamentals at work here. But as Jim and Rohit both said, and I would concur, you must look at the restructuring that's inevitable as an opportunity for creative, positive restructuring of the economy. And that is where I think that the agenda has to go in economics going forward. Finally, I would note an irony that the role for experts is something that this think tank group has talked about many times. And of course, experts are getting slammed and ignored, but I think ultimately are being proven right by this disease. And it's acknowledging the limits of knowledge, but still being better than the alternatives of fear and scapegoating. And it's an irony that the central bankers have gotten away with more support than the public health officials in this cycle, which is not something as a former central banker I would ever have imagined. So just to say that for the public health people, don't lose faith. You can win back the support. Thank you very much.
Thank you very much, Adam. We now turn to Sven Smith from McKinsey Global Institute. Sven?
Thank you, Jim. And it's great to be here with all of you. It is a super important time for us all to collaborate, to learn from each other, but also to shape the debate that will shape the future from this crisis that is as deep as Adam just laid out in many dimensions. I wanted to add to that and maybe also give the perspective from how the businesses that we are talking to and analyzing are responding to this moment, and how that then will trickle down again. So you take the macro that Adam just talked about, and I'll maybe take a bit of the micro, and also think about how consumers are operating in this moment. Like Adam said, aggregate economies are responding to the virus, and it's the virus that dictates the economy at the moment. It's also the virus that dictates the behavior. The reality is that we see a bunch of countries that have the virus under control, and that doesn't mean it's zero, but it's near zero. And in that environment, people are less afraid of the virus and they're willing to go out. It is actually still the fear of the virus that we see as the main factor why people are out, much less so the government policy. You actually see places where things have opened up and people stay inside, and you see places where things are closed down and people coming out because they're basically reacting first and foremost to the signals they get about their personal safety in terms of safeguarding their lives. And you see that behavior very different between people that still work the essential jobs and the people that are working from home. Actually, we, the workers from home, are causing the largest decline in this economy at the moment. It's us not spending on personal services. That's a big chunk of spending that's going out, which triggers also the additional inequality that we see. We are thinking about scenarios in this moment, and that's also what we see businesses do. The range of scenarios that are being considered by businesses at the moment, sort of from a macro level by country, is so wide-ranging, much wider than it has been in the global financial crisis, which is building on what James said. Crushing the uncertainty is one of the things that would help a lot. It's not easy, but this is one of the things maybe where we all can help a little bit. We now see executives saying that it might, after this enormous dip that we have, it might take 2 to 3 years until we're back up. That sort of gets a 35% vote from executives. They might not know, but that's what they think. And the next scenario is one that takes 6 quarters to be back up, much, much faster. That gets another 15% vote. But then the other ones are all around from much better to even much worse than that. And the spread of how executives think about where this economy is going is wider than I've ever seen. And as a result, they are not only replanning 2020, they're also replanning 2022, and they're making very severe decisions on how to shape their companies and how to reconstruct industries even in this environment. They of course all hope that all the stimulus is landing in the right place, but if you think about the human behavior again, somebody who's afraid of their jobs or is working from home is not going to spend more just because the government puts money in. They will really only come back when they find a form of life to be back for them. And that's what we see in the countries that have the virus more under control. And we see that the economic outcome in the countries that have the virus less under control is actually worse. Sweden is a great example, which maybe was experimenting in a different path, but actually the economic impact is as deep than the countries that had more control. What we also see that businesses are doing is a dramatic acceleration of the future. When we looked at the trends that we with MGI have been predicting for the future, and many think tanks have been working on, we see actually that the vast majority of these trends are accelerating. And that is because the event triggers a massive acceleration. Adam, you mentioned digital, but it's really all forms of digital. It's the e-commerce site and home delivery, it's the digitization of processes. Let me call out one area that worries me a little bit. When we did the future of work, and we've written lots of reports about it, which said that 50% of tasks could be automated with currently available technologies, we thought it might take a decade or more to get there. And if I look at the speed at which companies are now implementing these technologies, it might actually take much less than those 10 years. And if you then look at the overlap between the COVID affected jobs and the future of work affected jobs, that overlap is maybe 50%. And that means that you get a shock in the labor market that we weren't expecting with the normal evolution of future of work, because reskilling and mobility could have solved some of that rotation that maybe now can't be solved. And so that is an area that I think needs a lot of attention that we should all work on a little bit. What do we do with the future of work comes in 3 years rather than in 10? And we see the executives doing this. If you want to know why they think they are faster, I've asked hundreds of executives, why is everything so fast? The big difference that they see now is they have a fixed deadline.
1 minute remaining.
Yep, they have a fixed deadline, and as a result, against that fixed deadline, they can only choose available options. The second is they're so busy they can't argue anymore. And the third, they actually trust in this time each other much better. I will, although this is a very tough time, raise one point of optimism, is the innovation engine that is currently launched on the planet to solve this issue together, and the thinking that we're putting together here also as a group is unique. And I feel that sometimes 2 days process 3 months of innovation. And it's in that innovation I see the possibility of hope that we might come out a little better than the worst and blacker scenarios that you can see in this time. but it's all of us that will need to promote the best innovations that will bring this thing forward away from a 1 in 60-year virus and a 1 in 80-year economy to something where we've learned something and maybe created something new. You're on mute, James.
Jim, you're muted.
Sven and Adam, thank you very much. You have provided both a realistic assessment of where we are and where we might go, but also provided some hope and optimism about the future. We will now hear from the 5 working groups, and I turn it over immediately to Aaron Scholl, who will chair the first working group report.
Great, thank you very much, Jim. It's a pleasure and an honor to be with you this morning. If I could have the team bring up the slide deck to go with the presentation. Let me just first say that this was something special. I've never seen anything like this in my career, where the world's think tanks came together. And this was something where everyone was working as best they could to deliver on this. So maybe we'll turn to the next slide, please. My co-chair for this working group was Samir Saran from ORF in India. And let me just say, he's an extremely impressive, extremely bright and well-spoken individual. It was an absolute pleasure to work with him and to co-chair this group. Next slide, please. As you can see from the slide, there was representatives from a range of countries: Belgium, Israel, Canada, Hong Kong, India, Pakistan, the UK, and the USA, just to name some of them. Next slide, please. Our objectives were twofold. The first was short-term. We had to come up with ideas for here and for now that policymakers could actually take on board. But we also were cognizant of the fact that we need ideas for systemic change, and that there will be issues like this that come in the future, and we need to be cognizant of that. So in order to do that, we looked at 7 different areas, but basically it was knowledge sharing and information sharing, best practices, health coverage and how we make sure that individuals are covered, equitable distribution, harnessing technology, and increasing preparedness domestically. Because it's clear to us, the one thing that we know for sure is how little we actually know about this virus. As an example, do asymptomatic carriers shed the virus in a way that is as potent as symptomatic ones? We don't know. Which treatments work best? We don't know. How long will someone who has been infected be immune for? We don't know. But it's not our job to answer these questions, but it is our job as think tank executives and scholars to be able to articulate a policy framework so that when we do know the answer to these questions, the policy, legislative, and regulatory frameworks are there to assist and to save lives and livelihoods. It was an absolute privilege for me to co-chair this working group and for a group of such exceptional scholars from all over the world. And so with no further ado, let me turn to our first scholar, Bridget Wagner from the United States. Bridget, over to you.
Thank you, Aaron. First slide, please. In an era of mobile populations, international travel, and global trade, it's even more important that we collaborate to share knowledge and best practices across governments, private sector, NGO, and the think tank community, as Jim has said. Particularly in the emerging world, think tanks can augment state capacity, and partnerships with global and regional think tanks can aid in cross-pollination of perspectives and in sharing of innovations and the technologies needed to address the pandemic. As we've seen in this rapidly changing environment, there is a critical need for consistent, reliable, and disaggregated data. We called for an increased investment in testing to provide the data that's necessary to develop trends. The data is also critical to tracking hotspots and protecting vulnerable populations. And we noted that transparency and data sharing allows for greater accountability with the public and more rapid updating of the models our health officials have been relying on. We've seen that many governments streamline regulations in order to spur innovation in tests, treatments, and vaccines. We should also look to reform legal regimes to facilitate this innovation. And like the Tech for All subgroup, we also identified the need for a mechanism or central repository to collect the data, assess the models, avoid ineffective solutions, and identify best practices. Next slide, please. Technology has played a pivotal role in the battle against COVID-19. It has also given us a better understanding of the benefits of a tech-enabled healthcare system. But we recognize integrating these technologies will require enhanced privacy protections and security protocols, particularly if we want to collect data sufficient to develop predictive analytics and also meet the need for information sharing between providers and new payment systems. We have seen that telemedicine and supportive digital technologies have contributed significantly to non-COVID care as they reduce the risk of disease transmission and lighten the burden on providers and hospitals. Efficiencies can also be gained by expanding the use of electronic administration of medical licenses, insurance, and even e-passes for travel. We have seen that traditional and social media have played an important role in providing information to the public, but there is also a need to deal with misinformation, particularly in the online environment. The Tech for All team echoed the call for data collection and trend spotting, and they zeroed in on the role for big data analysis and the potential for providing prescriptive information to governments, international organizations, and citizens. Finally, it was noted that digital technologies have played an important role in containing the virus, as in the case of South Korea's use of contact tracing apps, and in sharing best practices, as many members of the medical community took to social media portals and peer networks to discuss treatment results. Thank you. Next slide.
We'll now have Pamela Tin from our Hong Kong Foundation to give us the recommendations for treatment of non-COVID patients.
Okay, thank you. So the COVID-19 pandemic has impacted on all health systems, obviously, and basically jurisdictions with highest healthcare expenditure per capita haven't necessarily best responded to the pandemic. And by responding, we're not only talking about treating COVID patients, but also non-COVID patients, such as those with chronic diseases requiring regular care. So one chief impact of the pandemic has been the disruptions in general health services for non-COVID patients. Factors recognize that impact care received by non-COVID patients include healthcare providers have been observed to prioritize care for COVID patients, particularly in hospital settings. The repurposing of the healthcare workforce to address COVID treatment gaps, which means that existing services such as immunization programs have been curtailed. Hospital and medical facility closures have impacted on service provision, supply chain disruption for medicines and resources, and also from a patient perspective, the risk aversion to prevent healthcare setting acquired infection also contributed to the delay of necessary and timely treatment for non-COVID patients. So with these disruptions are of course also an array of opportunities, such as what Bridget has already discussed, namely leveraging on technology and of course also considering new digital options to enhance and expand non-COVID healthcare. But also in moving forward, we look to prevent interrupting vital care for non-COVID patients at times of future public health crises. And a few directions that we have recognized include the need for policymakers to consider designating hospitals and health facilities specifically for infectious diseases to maintain healthcare access for non-COVID patients of these identified sites. And we think that, of course, clear care protocols must be in place for this. Okay, thank you. And secondly, of course, surge response should be considered for hotspots with expected patient spikes to improve the efficiency of healthcare delivery and targeted distribution of vital medical resources and personnel. Universal threat levels should and could be developed using internationally agreed upon metrics to guide this deployment. And finally, of course, healthcare workforce shortages across the globe threaten access to care. So we feel that policymakers should increase the funding for education and support continuous training to ensure that an adequate workforce will be in supply when we face future public health crises. Next slide, please.
Thank you. We now have Saba Shahid from the Center for Public Policy and Governance, Forman Christian College, Pakistan.
Okay, thank you. So on accelerating access to universal health coverage and ensuring equitable distribution of vaccines, medicines, and capabilities, our recommendations revolve around the idea that this is really an opportunity for leaders to step up and disrupt adverse political inertia. And conduct radical reforms. Jumping into some more specific recommendations, the first has to do with reducing financial barriers to healthcare services. Governments really need to increase public spending on health with a special focus on primary and preventative healthcare services. The second recommendation pertains to taking advantage of digital opportunities. Bridget and Pam spoke about this earlier as well. But this is important not only to increase access to health services, but to reduce out-of-pocket spending, which is particularly very high for developing countries. Additionally, technology is a vital tool to gather data for informed health policies. Building local capacity is another major recommendation. We cannot ignore the value of localized knowledge and experiences in informing decision makers and policy makers. So we really need to invest and empower our civil society organizations and local governments. A fourth area that we have to look to is strengthening the role of the media, not only to promote evidence-based information, but also to curb the spread of disinformation. And the media has a significant role to play in terms of promoting and protecting the rights of the more vulnerable populations. There is a strong emphasis on multinational cooperation as well, with respect to the distribution of vaccines, medicines, and technical capabilities. Think tanks can augment this cooperation by advocating that resources are shared equitably amongst countries despite differences in economic status or political ideology. Next slide, please. With respect to health preparedness and building resilience, a starting point is to encourage nations to abide by international evaluations that help countries assess their preparedness. And this should hold true across the regime spectrum. However, building resilience to health crises such as COVID-19 demands appraisals that are based on modeling and best practices in health-related industries. And this, of course, will feed into the development of early warning systems. Reforming care systems and law enforcement is another policy recommendation. Frameworks to reduce overcrowding in facilities such as care homes, orphanages, and prisons need to be designed. Finally, we need to encourage the integration of anticipatory governance into our decision-making processes. This implies predicting the impact of policy changes so that we can minimize negative spillovers and adverse reactions to a particular policy. Anticipatory governance would therefore allow policy analysts to appraise threats and manage these accordingly. Thank you.
We'll now have the closing remarks from Working Group Co-Chair Samir Saran, who's President of Observer Research Foundation India.
Thank you, Letitia. Thank you to all the 36 working group members from 17 institutions and 2 in their individual capacities spanning the world. We were trying to get the times coordinated between Hong Kong and the Americas. And I must congratulate all of them for having worked together to put together this very succinct report and very pithy recommendations for many of us to consider. Jim had asked us that what could we do as a global community. I think our report, and you can download it from Jim's website or our institutional websites, is actually a part of the global public good that we are trying to create as a think tank community. Aaron's leadership was admirable, but I think this is the time to acknowledge that the project that Jim started a decade and a half ago to build a global community came through. Jim, the project that you started demonstrated its capabilities to work from home, to be digitally connected and work as a cohesive community, to bring best practices, ideas, knowledge, and solutions for everyone to consider. All of us have not signed up to every of our recommendations, but these are very persuasive ideas for us to pursue. So with that, let me just end this session and hand it back to Jim with a big thank you to all the team members and a special congratulations to Letitia, who was like the Sherpa of this group. Jim, over to you. Jim, you're muted.
I'm self-muting continually and not remembering to. I want to thank Aaron, Lakeisha, and Samir for your excellent and heroic work in pulling this team together. I now want to call on Abla Latif from the Egyptian Center for Economic Studies to report out on Working Group 2.
Yes, hello, Jim. Hello, everyone. Can I have the presentation, please? Can you have the third slide, please? Yes, Working Group 2, preparing national and international strategies for economic recovery and revitalization. On behalf of our entire team from all over the world and on my personal behalf, we welcome all of you. First slide, please. Our objective is to offer strategic direction and guidelines for action-oriented policies to help nations, regions, and the globe recover in a healthy way. And this means sustainable recovery from COVID-19. Anything other than sustainable recovery will not be substantial, nor will it protect the world from collapse. Sustainable recovery is a resilient and inclusive one. Next slide, please. Next slide, please. Yes. We believe that there are preconditions for success in economic recovery, and the preconditions are all actually health-related, because we believe that adopting an effective public health policy is actually sound economic policy. Some specific examples: the governments need to make sure that there are medical facilities available to treat all, and they need to make sure that the conditions for reopening are safe. They need to have a coordinated, rapid response to disaster, and they must prepare for future pandemics, take it as top priority. Government must also work on health, economic, freedom of society dimensions all together in concert and not as competing targets, because a physically healthy society is an economically strong and free society. Next, please. We also believe that there are basic principles that support the realization of the objective. The first and most important, that the driving concept should be to build forward better, not just rebuild all the unsustainable systems. We need to be consistent with SDGs, invest in human capital, especially education and health, seek improved efficiency and effective governance, and be dynamic and flexible. Next, please. Next, please. National policies and international strategies need to be coordinated, because can you go back, please? I haven't finished yet, please. They need to be coordinated together. We enshrine international cooperation. We need to support democracy and inclusive free markets and adjust incentives to mitigate ongoing health and climate crisis. We now move on to the specific recommendations in different areas. My colleagues will follow. Thank you.
Next slide. This is Jan Hagemeyer from Poland. So as far as sustainable economic policies are concerned, we focus mainly on monetary and fiscal policy. Our main question is how to balance short-term and long-term as far as economic and social objectives are concerned. So the main message is that we don't want the crisis experience to go to waste. In our belief, the priority should be to improve the efficient use of resources. We're also targeting inclusive growth and social justice. And this should apply both to developed and developing countries. In particular, we think that public support should not address highly inefficient firms, and the tax system should account for increasing inequality. It is important to undertake a policy mix which ensures liquidity and emergency funding while maintaining prudent fiscal planning to maintain medium and long-term goals. What's more important, or equally important, is that governments should resist the temptation to delay structural and institutional reforms, including those which mitigate bureaucratic burdens in business, encourage a flexible labor market, and they should enhance tax collection. And as a last point, we think that lender countries and institutions should in general prepare for possible debt restructuring and consider linking debt forgiveness to issuers implementing recommended reforms. Next slide, thank you.
Yes, hello, it's me again. Next slide is the informal economy, and our key messages, that countries need to see that the informal sector is not a burden on the economy, but rather actually a jewel in the rough if it is properly accommodated. If it's properly accommodated in the economy, it will strengthen the economy and increase inclusiveness and resilience. And we have to remember that lots of women are actually employed in the informal sector. irrespective of the country and its culture. The strategic approach to dealing with the informal sector needs to rely on 3 pillars: building updated databases, making formality the easiest and most desired solution, and adopting a comprehensive reform approach to informality, i.e. one that adopts different policies for the newcomers, for the existing stock, for different types of informality. Some of the examples for reducing the inflow to informal employment would be associated with creation of private sector, growth in private sector jobs, and promotion social mobility, and creation of entrepreneurship ecosystem, because lots of entrepreneurship attempts are in the informal sector. Thank you. Next slide, please.
Yes, my name is Mark Elder at the Institute for Global Environmental Strategies in Japan. This section is about the roles of government, private sector, and civil society. I have 4 key points, starting with the government. First, recovery assistance efforts need to highlight and promote the principles of resilience, adaptation, and sustainability over an extended period. Especially government assistance should be conditioned on ESG, environment, social governance criteria, in line with the Sustainable Development Goals. Second, governments should prioritize sustaining the social safety net within a framework that also addresses other urgent issues such as climate change and sustainable infrastructure investment. Maintaining employment should be the focus, and regulations relating to environment, health, safety, and consumer protections should not be relaxed. Third, the private sector needs to develop safe and sustainable working procedures and safely and sustainably provide goods and services. And then fourth, multi-stakeholder collaboration with civil society groups will ensure robust, effective, and sustainable outcomes. Thank you. Next slide, please.
Hi, I'm Tetsushi Sonobe, Asian Development Bank Institute on digitalization as a driver of economic recovery. It's now widely recognized that digital infrastructure and technologies are vital to maintaining productivity and controlling costs in the COVID-19 era. Greater investment in this infrastructure and improved efficiency could boost economic recovery. Global leaders are advised to encourage the public and private sectors to leverage the drastically increased demand for digitalization. Yet significant hurdles remain. Disruptive innovation tends to eliminate jobs, even though it creates new employment opportunities over time. This phenomenon has disproportionately affected less educated, more vulnerable groups, while the benefits have accrued among the better off. It's imperative that global leaders address such bias and promote digital inclusion by means of education and training programs, as well as strengthen efforts to protect consumers and combat cyber threats and privacy. In addition, antitrust legislation and closing tax loopholes domestically and internationally could help address concerns about market concentration and tax base erosion by platform and tech giants. Global leaders should work together to this end. Capturing tax revenues could provide resources to support digitalization, while rewarding innovators with a smaller slice of a larger pie. Next slide, please.
The slide is up.
This is for Maria.
Maria.
Good morning. This is Maria Clara from ICP Colombia. Small and medium-sized enterprises play a fundamental role in the world economy. They are strongly related to economic growth, employment generation, and will contribute to achieve some of the Sustainable Development Goals. Since COVID-19 has affected large and small enterprises, but the effects have been especially severe on the SMEs, it is necessary to support them to float and recover with short, medium, and long-term measures. SMEs need to be safe to reopen. Safety guidelines should be established, including protective equipment when required. SMEs also need liquidity to survive. They need subsidies to support workers' salaries and protect the credit flow. SMEs also require less tax burdens and more flexibilization. It is necessary to make the creation and operation of SMEs easier. A more efficient tax code should be designed, and the costs associated with formal operations should be reduced. SMEs require establishing linkages with bigger companies so they can be part of the value chains of production. All these measures will be successful in an environment of economic liberties. Next, please.
So if I can conclude, let's say this group, sorry, I was waiting for Maria, let's say, to speak about another slide, but what we have seen during this crisis, we believe there has been a lack of international coordination. And I compare a lot, let's say, to what has happened after the financial crisis in 2008, 2009. Let's say we had a central role of the Financial Stability Board. We believe we should create something like a global healthcare stability or a global healthcare sustainability board, which brings together as well the healthcare officials of the WHO with economic policy officials from the OECD, IMF, and World Bank. I think, let's say, a reform should probably come from within the membership of the G7 and the G20 to drive that, that global healthcare stability board. I mean, I think Europe should start with reforming its representation in the G7. Don't forget, let's say, that Europe has 4 of the 7 seats in the G7, which is a bit kind of an anachronism. Europe could have a single seat, or at least the EU could have a single seat, and we could take up, for example, China and India in the G7, and then have another G20 as well, which would be basically the central coordinating body for healthcare reform in a global context. And from there, we could also take, I think, the much needed governance reforms of the World Trade Organization, the World Health Organization, and review their governance, as I said, as well as looking at the quota and funding of the IMF. I mean, because all these 3 organizations are central in the current context. I think about, above all, about the WHO, and I'm a bit surprised, let's say, that the previous group didn't address this so much, but if I think about that, there are private donors to the WHO, let's say, which should be a publicly funded organization. I don't fully understand this. But let me thank, let's say, our members of our group, let's say, also on behalf of ABLA, let's say, that we managed to work so well together, addressing what I thought initially, Jim, to be a very complex issue to address, but we managed to do it well. And I hope, let's say, we will bring some traction to advance this issue at a global stage. So thank you very much, Jim, ABLA, and all the members of the group, and also Louisa from SEPS, who helped, let's say, to bring it all together.
Thank you, Carl and ABLA. As you well know, and all of the participants at the first summit identified the focus of your group as their 76% of those who responded to the survey indicated that the work of your group was the most important priority. And so it is wonderful in terms of the recommendations that you have provided us all with. I now turn it over to Winnie Satchelberg from the Center for American Progress and Klaus Alexander Steyer from the Gatilio Vargas Foundation that have focused on the important issue of helping those who are made more vulnerable by this crisis and how to respond.
Thank
Winnie,
you so much.
Klaus?
Thank you so much, Jim, for your leadership. First slide, please. I want to thank my co-chair, Klaus Steyer from FGV, and Marlos Lima as well for your leadership. We had an impressive, next slide, please, an impressive group of over 20 members from around the globe working on innovative strategies to help the most vulnerable communities. They are an impressive strategic group, and I think a real reflection of Jim's vision and leadership and reason for our being here together. As the COVID-19 pandemic has left the world, next slide please, left the world in an unprecedented crisis, vulnerable communities have been hit with disproportionate devastation. This crisis has further illuminated systemic fragilities and social inequities within our societies. And it's incumbent upon all of us, think tanks, governments, policymakers, to address the needs of our most vulnerable citizens. As a global per capita income is expected to fall and mass employment will rise to historic levels this year, it is the duty of all of us to act and to act together. Working Group 3 has compiled recommendations based on tested methods and the forward thinking necessary to tackle the challenges that face the world's most vulnerable people. We are focused on women, youth, the elderly, migrants, and racial and ethnic minorities. And I will turn it over to my esteemed co-chair, Klaus Steyer, to lead us through the next slide. Thank you.
Yes, Winnie, thank you. Can you go back to the other slide? Thank you. So if we know that the pandemic is a general phenomenon and that every one of us affected by it, we also know that some groups will be more affected than others during this crisis. So how could we better understand and present the impacts of this crisis in the most affected groups of citizens? What we did is we distributed the 20 members of our group into 5 different subgroups, and each subgroup addressed challenges of specific vulnerable populations. So children and youth, elderly, women in vulnerable conditions, migrants, and racial and ethnic minorities. And to highlight some of the major challenges faced by those groups and also propose positive interventions, we have here today one representative of each subgroup to present their findings. Next.
Thank you.
Mr. Peter Platon from the National Administration Association Romania. Children and youth are always very exposed groups during turbulent times. Can you share with us a main concern, but also a positive intervention of your subgroup?
Yes, thank you. I will start with to cite a paragraph from the 1924 Geneva Declaration for the Rights of the Child. It states, "The child that is hungry must be fed, the child that is sick must be nursed, the child must be the first to receive relief in times of distress." By these principles, the founding fathers of the European Union designed the Common Agriculture Policy, one of the pillars of the EU. Its main purpose was to provide food for each European Union citizen. But the COVID crisis challenged the rule of law principles and also challenged well and long established mechanisms. After a short and intense period time when European member states hastily taken actions, the European Commission reasserted its role and implemented on the main European transport routes, the so-called green lanes, in order to preserve functionality and operationality of the supply chains, critical supply chains for food, medical equipment, and other essential goods. The lesson learned is that we have to maintain within pandemics the critical supply chains fully operational and functional. And we may do this by establishing green lanes as the European Commission did in the European Union. But the green lanes functioned in the case of goods, but in the case of people, they did not function. We have to address this in the future. In order to do this, we have to explore and evaluate if we may transfer competencies from the national level to the supranational level in the field of health and emergency management for saving the lives of the children. Thank you.
Thank you, Mr. Petre. Next, please. Dear Professor Martin Rupiah from Accord in South Africa, your subgroup studied specifically the impacts of the crisis on the elderly. What challenge would you share with us here today, and what would you propose as a recommendation? Your mic is, sorry, Professor, your mic is, we're not hearing you. Yes, thank you.
All right, now I'm sure I can be heard. Okay, Martin Rupiah from the African Center of Constructive Conflict Resolution Disputes in South Africa. Our research, Klaus and Winnie, as you know, looked at the impact of COVID-19 on the elderly. And the research team was very surprised to find that there's a greater impact for those aged 60 and 65 going forward. Secondly, the impact also is different between developed countries and developing countries. As I'm sure you're now aware, in the developed countries, the epicenters of the elderly were around care homes. Now, this is not true when you come to developing countries, Africa and other areas, where the elderly are within communities and almost many of them in informal settlements. So here we discovered a very important dynamic of the impact of COVID-19. So the key recommendations that we brought up were first to urge government, policymakers, and think tanks to undertake robust analysis of the risks that are associated with the different human underlying conditions, because it is the underlying conditions of the elderly that exacerbates and that places that category in the highest risk groups, on COVID-19. And so we are urging governments to begin to create targeted shielding policies to mitigate the effects of COVID-19. The second recommendation was to see that there is increased funding and resources towards supporting both in the developed world and developing countries. One of the characteristics of the lockdowns, for example, was to create a curfew around communities. And within the informal settlements, the elderly would not be able to access public health or even private health facilities. So those were two important recommendations, but important to acknowledge that the impact of COVID-19 has been greater on the elderly, also the disabled, and also the male type of persons.
Thank you, Professor Marty. Next, please. Winnie, I welcome you back to represent the subgroup Women in Vulnerable Conditions. Can you share with us some of the main concerns identified by the group?
Yes, thank you, Klaus. Our group, as you can see from this slide, had a number of fantastic members. The pandemic has affected every aspect of life for vulnerable communities, especially for vulnerable women. Vulnerable women include women who are trapped in abusive relationships, women living in poverty, malnourished women, and pregnant women. This crisis has exacerbated conditions that were precarious before the global pandemic. And as unemployment rises, women are losing jobs at disproportionately high rates. As women are left jobless at a higher rate than men, this gives way to a greater reliance on abusive partners. This is something that our group looked at. During the crisis, France, Argentina, Singapore, Canada, Germany, Spain, the UK, and the United States have all seen spikes in domestic violence reports. Because women are disproportionately affected by violence and joblessness brought on by the pandemic, it is vital for strategies to specifically target women when addressing the effects of the COVID-19 pandemic. We use this information to guide our interventions and recommendations. And our recommendations are as follows. Protective measures specifically designed for female victims of violence should remain accessible and open despite travel restrictions and quarantine orders. Access to justice for victims of gender-based violence must be a top priority throughout the development of COVID-19 contingency plans. There must be various methods available to victims of gender-based violence to file complaints and to seek protection or shelter. Electronic methods should be explored with travel restrictions and quarantine methods kept in mind. And finally, countries must recognize the disparate effects of COVID-19 on female migrants. Migratory status should not affect access to healthcare and prevention services. Thank you, Klaus.
Thank you, Winnie. Next, to complement the views on the migrants that Winnie just talked about, William Huang, the youngest from our group, and your group presented a very interesting work on migrants. What major concern regarding migrants would you highlight here today, William?
Well, thank you, Klaus. I'm William from TTCSB, speaking to you from Taiwan. So Dr. McGann, distinguished ambassadors, esteemed think tank executives, and scholars from all around the world. As countries battle to protect their populations and their economies, fundamental norms of refugee law and human rights law are at risk. For more than 167 countries have partially or completely closed their borders, while 57 states are making no exception for asylum seekers. On a heavier note, the often overcrowded facilities where migrants are detained and processed. Adequate sanitation and physical distancing are almost impossible to achieve, leaving migrants prone to contract and spread the coronavirus. This is the reason why we have identified our main challenge in this context as to address locations where migrants and displaced people should be prioritized for health, sanitation, and economic protection. We not only suggest interventions at the immediate level to resolve the short term, we also identify specific measures at a succeeding level for the longer term. As an example, the UNHCR, in cooperation with other IGOs, has coordinated an emergency response to deliver aid and proliferate testing to halt the spread in the immediate term. Following that, we have empowerment methods by the NGO AIR that prevents migrants from being double casualties of both infection and destitution as a result of the COVID response, alongside with inclusive methods to facilitate a transition into the local economy and advocate for community-based alternatives to custodial ones when dealing with migrants. Accordingly, international responsibility and burden sharing for vulnerable groups like migrants will be crucial for our global survival. I would like to give special thanks to Dr. Mary Martin for her incredible contribution and Dr. McGann for this amazing opportunity. I now yield my time.
Okay, thank you, William. Next, please. Dina Dajani.
Yes, hi.
Policy. Your group showed a great interaction, and the moment's particularly important to hear about your conclusions and recommendations. Please tell us a bit about your findings.
Thank you, Klaus, Winnie, and Jim. Can you hear me okay? Yes?
Yes, yes, yes.
Okay, great. Yes, our group's focus is on racial and ethnic minorities and the effect COVID has had on those communities. This was a wide-ranging conversation as racial and ethnic minorities live everywhere with a variety of different lifestyles, from those living in relatively isolated agrarian communities to refugees living in camp environments to racial minorities living in US urban settings. The list is endless. And my group attempted to identify a similarly wide-ranging list of recommendations that would match that diversity. We had 6 recommendations to address how to best support those communities during a pandemic, and I refer you back to our main document for the entirety of those recommendations. But to put a couple of them in front of you, our first recommendation is to prioritize public health programming focused on non-pharmaceutical interventions with deep considerations of the social determinants of health. This will allow responders to focus on those within the community with the largest burden of disease, which increases the likelihood of infection, fatality, and associated long-term conditions, and to build policies with a consideration of the primacy of non-pharmaceutical interventions. We also recognize the importance of the development and prioritization of local government support. And there's many issues that fall under this category. Local governments should develop programming to support housing, employment stability, and tech solutions, as well as internet access for racial and ethnic minorities. We have additional recommendations closely linked to this one, and that's developing greater localization and diversification of services and supply chains to create resiliency against the fragility that our global systems have, which COVID-19 has really pushed forward and revealed to us. The vulnerabilities of the populations discussed here is well documented, and promoting health and stability through local government support will increase economic stability and overall stability and security of these populations and the greater communities in which they live. Thank you, Klaus and Winnie and Jim, and all my fabulous group members. This has been a really great experience. Back to you, Klaus.
Thank you, Dina, and thank you all. Next. I really appreciate the hard work that all of you have done leading your subgroups. And we want to thank again all the group members that could not speak today, but are listening to the results of their work. If I may conclude with a final remark, I guess our presentation made clear that the vulnerable population is exposed to a number of threats on a day-to-day basis. Unfortunately, many of the recommended health measures used to prevent the spread of COVID also exacerbate the problems that groups experience: isolation, solitude, unemployment, access to basic public health systems. Immediate action is imperative, and think tanks must show the capacity of action during turbulent times. This is the moment to unite efforts, and this initiative shows the values of collaboration. Our ideas and actions are and will be pertinent to this crisis and beyond it when countries open up in the new normal. Thank you for this opportunity, Jim. Pass the floor to you.
Okay. Thank you, Klaus and Winnie, and your group for their excellent set of recommendations. I want to remind everyone that the decks, PowerPoint presentations from these sessions, working group sessions, and the final report will be made available. Keep in mind that these were produced in just 30 days, so we are still in the process of reviewing them, but they will all be posted and made available to all of you. I now turn the meeting or the next session over to Gustavo Martinez and Pablo Alva from CARI. Gustavo.
Good morning. I'm very pleased to meet you all today, at this virtually. I'd like to express my gratitude to the Lauder Institute, the CG, and especially Jim McGann and his team for making this great initiative possible. And let me extend my gratitude to the members of our group. The Working Group 4 focused on fostering international cooperation concerning the virus and potential near-term future waves. 16 think tanks from all across the world contributed to elaborate the working group document with 62 international cooperation public policy proposals. But let me tell you very quickly how we have coordinated our work. We were able to identify issues and proposals by structuring our analysis in multi-level matrix concerning governance, economy, health, and safety net levels, as well as local, regional, and global oriented actions. Please, next slide. All these proposals range from simple implementation proposals, such as decision to eliminate certain types of taxes to favor impacted economic sectors, to the call for the reconstruction of regional, economic, and political coordination bodies. But now I'd like to give the floor to the institution members of the Group 4, which are going to tell us some of the proposals. Andrés Ortega from Elcano Royal Institute from Spain, then Jessica Wau of Singapore Institute of International Affairs, and Karir El Ainouri of Policy Center for the New South of Morocco. Finally, my co-chair, Pablo Alva, will make the closing remarks. Thank you very much for your attention.
Hello, I am Andrés Ortega from Elcano Royal Institute in Spain. Many thanks for this initiative, Jim, and many thanks to Karin, to Pablo and Gustavo for coordinating so well this task force. The general issue was to make proposals on solutions to save lives and livelihoods. I insist on livelihoods also. And the general topic of our task was to deal with fostering international cooperation, creating rapid, responsive, and resilient systems to respond to future crises, which means the plurality of actors. From Elcano in Spain, we have chosen a very transversal and somewhat controversial issue, but we are here for that. Technology, and especially digitalization and artificial intelligence, has played a crucial part in how we have faced the crisis, both in health and in socio-economic terms, and in the way we work, and how we are facing the way out of it. Without this technology, the secret of the virus would not have been unveiled so quickly, and we would not be talking about the hope of having vaccines and at least treatments so soon. Cooperation among scientists is paramount. Without what tech has brought us, we would not have been able to continue in lockdown with an important part of our economic lives through work from home. COVID-19 has revealed the need for digitized process to keep operations running during a crisis. We don't pretend to stop technological progress. Quite the contrary, technology also creates new jobs, good ones at that. But in the face of soaring unemployment and deglobalization and reshoring that hurts the weakest, a temporary break should be put on the introduction of human task replacing technologies through automation, but not on human enhancing ones. Automation was partly responsible for the unemployment after the crisis that started in September 2008. We should manage better the situation this time in the face of new temptations and possibility to save, as I said, livelihoods. I must insist, this temporary pause should not be directed to labor replacing technology, but not to human enhancing ones. It could be used also to better manage the process of deglobalization on the way and to make reshoring less attractive. This pause should be used to foster urgent programs of skilling and reskilling that have become absolutely necessary and could be financed by the fiscal stimulus packages required to ensure a fast economic recovery. This pause should be agreed, not imposed at all levels, national, regional, and global, through tripartite social dialogues, governments, trade unions, and business unions. At the global level, the appropriate framework would be the ILO, International Labour Organization. This would also serve to protect and improve the lives of the most vulnerable ones. Many thanks again. Next.
Next.
Hello, I'm Jessica, and I'm speaking for the SIIA from Singapore. That's part of the regional organization, which is the Association of Southeast Asian Nations, or ASEAN. In Southeast Asia, the flow of goods, people, and services has been crucial for ASEAN's economic integration goals, and it will continue to be a priority for the region's post-pandemic recovery efforts. And supply chains have been essential in fostering global growth, but this deep interconnectedness also results in significant vulnerability when a crisis such as the COVID-19 pandemic hits. So if we look at ways that we can build resilient supply chains, we can look at it from 3 levels, which is on the local level, like what we've been talking about throughout this session, has been the use of technology. And for companies, it's about visibility of their supply chains that helps to make them more resilient. So this would be mapping them out through digitalization. This could be the use of data analytics or artificial intelligence. There's also talk of use of blockchain. Also, in terms of being more resilient, diversification needs to be considered, but this also has to be done with caution, just to search for alternatives to tackle the excessive concentration of suppliers, but it also comes at a cost. So businesses have to be aware of that. On the regional level, there are ways to be more prepared, and that involves cooperation. These can be emergency inventory and stockpiles in both the private and public sectors. And an example of that is the ASEAN Rice Reserve. So this also encourages countries not to be protectionist in terms of making sure that they keep all the reserves for themselves, but having it on a regional basis such that cooperation is fostered and encouraged. Also, we recognize that there needs to be greater regulatory coherence in the area of logistics, production, manufacturing, and distribution, especially in a region that's integrated across the land, sea, and air. But even within countries, there had to be more communication between agencies, governments, and the private sector. On a global level, there are some things that we can consider when the customs organizations work together with each other. These include authorized economic operators, where they just have standards and agreements where countries can allow the movement of goods freely, and this can be modified in times of crisis. And there are also open skies agreements that can help to tackle the capacity crunch. Thank you.
Kareem, unmute yourself. Yeah, there we go.
Thank you. Good afternoon, everybody, and thanks to everybody that is making this happen, and congratulations to you, Jim, and our friends also of CARI for being leading this effort. I think I have one single message. The presentation and the papers will be made available. One central recommendation here is really communication at 3 levels. Of course, at the international level, at the regional level, and at the local level, where we need more communication and expertise, sharing of knowledge and experiences. And I guess in this world, the communication is essential. And I think think tanks, with their capacity of creating platforms, are essential here. In this world where, you know, it has been quite difficult, as we have seen over the past couple of months and even a couple of years, to have you know, expert-based, evidence-based discussions, and it comes, of course, in the area of health, which has been the focus here, where we need to provide, you know, accurate information. And also, you know, capacity and capabilities around countries which can be unequal within, you know, between, say, developing world and advanced economies. So it has to do also for socioeconomic resilience. We had many discussions within our group, and I would like here to thank Mehdi Ben Omar, who has been active on our who's worked with me at the Policy Center on these issues. So it's a matter of leadership, and it's a matter of being able to discuss, you know, based on facts. And I think there comes the advantage and the capacity for think tanks to bring neutral platforms where dialogue, you know, stays relevant and efficient with, you know, with the purpose, which is here, you know, to be able to bring about you know, adequate response to challenges, and keep those, I insist again, channels of communication. I think our network, the advantage of our network and our strength is really that. I think we should continue to build on that, and this initiative, this very initiative you know, that is getting us together here, in itself is a proof of this capacity. We need to enlarge our constituency. We need to be able to reach out way beyond our community. But this is the unique characteristics of our group, and I think we should, you know, make sure we use it at its full potential to address these challenges, and within the framework of the North-South cooperation and also South-South cooperation. So that's in a nutshell what I wanted to say. And thanks again for all the colleagues that were you know, in this group with us.
Pablo.
Yes, as the remarks of the 62 proposals on cooperation and preparedness of Group 4, we find 5 general principles for the post-COVID world. The first one is that the severity of the crisis did not strengthen the international cooperation networks, as we expect. Rather than that, it weakened it. Each state set an individual policy reaction and prevention strategy for the stress situation. A second principle is that this situation of no cooperation is not new. We've seen it, and we see how multilateralism is getting weakened in trade, in finance, and climate change. The crisis in this case with the health system is much more serious, since that country went to a sum-zero game, playing their own strategy in their countries. Third principle is that regarding the situation of the international health system, the strengthening of the World Health Organization and its regional branches, and need a new global platform of cooperation. This platform should be based on scientific evidence, trust, and also use the use of artificial intelligence and data mining systems. The fourth principle is due to the economic system. We are facing the final challenges already of the exhausted Bretton Woods organization and the growing importance of G20 and the OECD as organization. This new way of diplomacy of the international organization should start having concrete solutions. And finally, for the safety net, the social safety net, the global financial system should be able to build a package of aid and assistance to least developing countries. It's urgent to respond to the economic, job, and social destruction caused by the pandemic. A great financial aid package is needed, so it's relaxation of the pressure of sovereign debts and reconstruction on the social assistance network of the national state. It is time for a new welfare state, more effective and modern, as an instrument to support vulnerable sector. Thank you very much, James McGann. Thank you very much, Philadelphia University and the program, and thank you very much for all the think tanks that work with us in this group 4.
Pablo, thank you. Pablo, thank you very much. I want to point out that and encourage all of the participants to post and use the Q&A function on your platform to pose questions for one or all of the panels and to participate in the policy briefing and public engagement sessions next week. We encourage your engagement and your questions and suggestions and recommendations so that they can be factored into the final report. So please use the Q&A, and those questions, comments, and suggestions will be forwarded to the respective groups. I now want to turn it over to Milena and Paolo Magri for the final session on how to be fit for uncertain times. And so Milena and Pablo. Pablo.
Okay, can we go to the next slide?
Here, Philadelphia.
We find ourselves in a now or never moment. We think tanks will either harness this crisis to change, to become stronger and more relevant in policy debates, or we may face extinction in the years to come. COVID-19 is changing everything about our reality. We can't host physical events and network. Funding is plummeting as donors are redirecting money to where they feel they can make a more tangible and more immediate impact. Our voices are getting lost in the noise of quick and easy information. Excuse me, I'm hearing Pablo, can you mute yourself? Thank you. Our voices are getting lost in the noise of quick and easy information springing from different sources, and our staff is stuck working remotely for months. These risks and concerns are definitely felt broadly and shared broadly among the think tank community. Can we see the next 2 slides, please, one after the other? As you can see on these 2 slides, 70 think tank executives from all around the world came together to discuss these challenges, share their experiences, and offer best practices and out-of-the-box proposals to reinvent our activities. We structured our discussion around 4 main thematic pillars: reinventing communications, events, fundraising, and research. So let's start with reinventing communication. The key question we raised is how to distill meaning from the chaos created by the overload of news and information about the pandemic, which has saturated the media landscape. Let me turn this question to Rob Louie from the Heritage Foundation, USA. Next slide, please.
Thank you. Well, communications is a persistent challenge for think tanks, whether that's reaching policymakers, the media, or the public at large. And let's face it, COVID-19 has made it even more challenging. Here are 3 recommendations. First, think tanks must stand out from others and cut through the noise by communicating on flagship initiatives. One case study that we have featured in the report is the National Coronavirus Recovery Commission, which the Heritage Foundation created. This commission brought together 17 outside experts to collaborate with our think tank's scholars. The commissioners did this voluntarily, contributing their expertise in medicine, business, government, and human behavior. Each commissioner's individual relationships and media exposure helped increase the visibility of this project. In total, the commission made more than 40,000 contacts with policymakers across the United States, and 35 states adopted the commission's top recommendations. We also had major media outlets continuing to look to the commission as a trusted source. Second, we strongly encourage think tanks to prioritize visible communication and stakeholder outreach initiatives. It's important to invest in new and diversified engagement formats and have tight security protocols for online discussions. The Ecologic Institute outlines the steps that think tanks should adopt in the report. There's also a case study in the report from Chatham House, which created a safe environment for strategic and sensitive discussions with its Common Futures conversations. Third and finally, think tanks must build alliances with media, such as investigative journalists. These partners can work with think tanks both on adding depth and on increasing the reach of your work. Partners can also help think tanks by providing content and identifying the best ways to communicate to the public, such as better targeting, tracking the interests of specific audiences, and creating email newsletters based on your subscribers' interests. Now is the time for think tanks to apply these out-of-the-box techniques to be timely, responsive, more innovative, and more attractive. Adapting for this ongoing crisis while also learning for the long run. Thank you, Milena.
Thanks, Rob. The second pillar, reinventing events, is strongly related to the previous one, of course, as communication strategies, skills, and tools are key, and all the more so in the new digital environment, to successful events. Precisely on reinventing events, we discussed how to take full advantage of the new digital context. This is a question for Tanubi Nagangam from Observer Research Foundation, India. Please, Tanubi.
Thank you, Milena. Good afternoon, all from India. I hope you're all keeping safe and healthy. So let me jump straight to the topic. Most of us have moved our conferences online. And while we've all needed to do some adapting, the digital medium certainly offers us a bouquet of opportunities. The obvious one, of course, is bringing the cost down of conferencing. By bringing the cost down, digital events have helped create a level playing ground. Many smaller think tanks with much smaller budgets, particularly from the Global South, now have a chance to be heard. Small conferences with good ideas can far outpace big conferences with not so good ideas. My second point is on access. The digital medium allows us to reach a much wider set of audience. Take today's session, for example. From what I hear, we have more than 200 participants who have joined us from a range of countries. Digital events also help us reach different constituencies, targeted constituencies that we want to go to. For example, the youth on Instagram. These new dimensions provide us with a unique opportunity to tailor our products with a much wider spectrum of resonance. It also gives us easy access to a diverse set of speakers and experts across geographies. And of course, there is the very important benefit. By reducing travel, virtual events have helped bring down the global carbon footprint. How then do we optimize virtual events? We need to reimagine how we engage with our audience. In the digital medium, participants, our audiences, will have much shorter attention span. As such, our sessions need to be shorter, more dynamic. We need to introduce interactive tools like simulation exercises, surveys, and polls. We also need to bring in some elements of the traditional format into this new avatar. For example, there was a discussion about introducing a virtual networking lounge where delegates could meet and chat with each other. And as we make this transition, organizers must work with speakers and moderators to help ease into the shift to this new format, which is more short, which is certainly more dynamic, and most importantly, it has so many new tech elements that we must grapple with. I'm told that Jim, the report will be up on Jim's website, and hope you get a chance to go through it. Over to you, Milena.
Thank you very much. Indeed, memorable events, new formats, new communication tools and skills are more than welcome in the post-COVID reality. But all this has to be done while our funding is decreased. So quite unexpectedly, fundraising turned out to be actually the top concern of our working group members. So how do we deal with falling revenues in a context of higher competition for funding and at the same time retain our integrity and independence? I turn this question to Mercedes Mendez-Vivas from CPEC Argentina. Please, Mercedes.
Thank you, Milena. So in this new context, we need to square the circle in which donors are diminishing their funding while think tanks are expected to do more and to be even more relevant than before, but with fewer resources. Our group identified various funding strategies and innovative ways on how we engage with donors and stakeholders while still preserving independence and integrity. First is donor engagement. Make donors feel they are part of your research by implementing highly personalized and tailored engaging activities. To keep donors near, dear, and clear, think tanks need to keep in touch with them through emails, social media, and special briefings, for example, making sure they understand how relevant our work is in these times, while thanking them for their support and making sure they feel involved. Secondly, it is imperative that you diversify sources of funding and not rely on any single donor. For example, international cooperation, private companies or foundations. You can also explore CSR activities. If one source fails, you still have the other. Thirdly, think tanks need to remain independent. When funding is scarce, it becomes especially relevant to monitor and control independence and avoid conflict of interest. There are tools that think tanks can put in place without the need for additional or specialized team. You can create project consortiums and with no private sector entity as the sole donor, or put in place already existing screening measures using models from international organizations and avoid potential conflict of interest. Finally, consider outsourcing research activities to peers operating in less developed parts of the world and spread the fundraising functions across your organization. Many thanks, Milena.
Gracias, Mercedes. Last but not least, we discuss how to reinvent research. While funding is getting scarcer, we need to cover new topics, for example, health-related issues, and do so in innovative ways. So how do we square the circle between scarcer resources and more demanding research priorities? Let me pose this question to Paul Morillas from CIDOB Spain. Paul.
Thank you very much, Milena. Also, thank you for an excellent coordination together with Paolo. Thank you very much, Jim, for the initiatives. From CIDOB, the Barcelona Center for International Affairs, I have 3 main points for you on how to reinvent research after the coronavirus. The first point for me is to distinguish ourselves from the varied number of relevant voices that are emerging. We think tanks need to move beyond traditional research and cover issues raised by COVID-19, but we cannot lose our essence to provide for systematic and in-depth analysis of the topics that we are discussing. We are not journalists, we are more analytical than that, we are more paused in a sense, and we need to carry on with that integrity of think tanks in terms of research. Second idea, we need to enhance multidisciplinarity across policy domains. We need big areas, but connected projects. And this means that we need to define our work. In CIDOB, we do global cities, migration, geopolitics, and sustainable development. These are very big topics, but what we do is we connect the projects between these main big topics. And this has to be done at the individual level of think tanks, but also among think tanks. And my third and last message is we need to move cooperation with other think tanks beyond single projects. We need to take partnerships to the next level. That means necessarily build enduring partnerships across think tanks that have similar research interests. And this will not be only a question of think tank networks, it will also be a question of joint research programs where our interests align. Thank you very much, Milena.
Thank you very much, Paul. So what is the fil rouge, the bottom line of our working group discussions? For this, over to you, Paolo.
Thank you, Milena. What can I add after my colleague's brilliant summary? 1 invitation and 3 quotes by someone you all know. First, the invitation. Stay with us and get a deeper understanding of our recommendation. Stay with us reading the full report we produced. You are all invited to our workshop on July the 10th. Now the 3 quotes. The first is from John Paul II. His first words as Pope were, "Don't be afraid." Let's not be afraid of the challenges of the pandemic, or even worse, by the pandemic of challenges we are facing. If we change and reform how we operate, we will survive. It sounds a bit like Gloria Gaynor, but please don't count it in my 3 quotes. Many are saying we are now at war. I don't know, but we do know that many of our institutes survived real wars, the First and the Second World War. Milena Institute in Serbia, like many others, was created after a war, the war in former Yugoslavia. Changes and reforms are hard, but possible. Let's not be afraid. The second quote is from Kofi Annan. When launching the reform exercise at the UN, he said, "Reform is a process, not an event." In fact, this town hall is an event which is accompanying a process, a long journey of changes and reforms on how think tanks operate. It will take time, more town hall, more ideas, more gym, more joint works, but let's be patient in a hurry, I would say. My third and last quote is from Aesop, the ancient Greek storyteller. "United we stand, divided we fall." Indeed, we should stand united with our staff, our stakeholders, our sponsor, among ourselves, as we are doing today, while experiencing the deeper division within and among our nations. A loud and clear message should come from our community, a message of unity and cooperation. Next slide, please. Or previous slide, because it was on screen before. Some of you may recall the 2 images, the one you are seeing now, I presented at the first town hall to stress the imperative for change. The tale of the 2 cocktail bars, very fancy, side by side in a small street in Milan. Both closed when lockdown started. One reopened during lockdown. How? Radically changing its business model from cocktail bar, an essential business. The good news, we need good news. The good news is that both bars have now reopened with less clients and less business given social distancing. But something happened. They used to be competitors, side-by-side competitors, and they have now merged their operation and staff and sell cocktail plus food. Changed and united, they are both back on the market. So should we. Thank you, all the members of my group. Thank you, Jim. Thank you all.
Bravo, Paolo.
Thank you very much, Paolo and Milena, for your efforts and your team and your exemplary report, which will hopefully help all of us survive and continue to serve. We now turn to the final segment of the program, which is designed to provide some suggestions from a distinguished group of policymakers who will share their thoughts on how to increase the policy uptake from their personal experiences as leading policymakers from across the globe. I now turn it over to my good friend and colleague at Brookings, General John Allen. John?
Good morning, Jim, and good morning to my colleagues in the US. Good afternoon and good evening to my colleagues around the world. I'm John Allen, as Jim said, and I'm the president of the Brookings Institution, and it is a great privilege and a pleasure to be with you all today and to see so many good friends coming together for this very important cause. And as many people have this morning, let me just take a moment as well to thank Jim again for his initiative and the work that he's put in to this third global think tank town hall. Now, in a couple of minutes, we'll hear from our last panel. But before we begin, I'd like to offer some of my own brief thoughts. When we last convened in April, the future of the community, like the rest of the world, seemed mired in uncertainty. The geopolitical landscape shifted by the advent of COVID-19. That lethal global pandemic ushered in challenges that few of us had ever seen or foreseen. At the time, the mere idea of recovery from this global health crisis seemed only a distant thought. As heads of think tanks, as well as scholars within our own rights, we concluded that it was our shared responsibility to provide the needed research and analysis to civic leaders, to policymakers, and to others capable of enacting change. Now, months later, I'm pleased to see, just as Paolo Magri just showed us, that many of those leaders have taken our creed to task. Leaders have reacted by making decisions to take risk as we move forward. Measured risk for our health, but risk nonetheless. And I myself am proud that Brookings has contributed to this with the launch of our project, The Reopening of America and the World, which we launched last month, and we'll be beginning shortly on a project called The Blueprint for Recovery, Reform, and Renewal. Still, as evidenced from our many panels today, there are still many challenges ahead. And I encourage us all to remain vigilant and connected in our efforts, as it is so crucial that we continue to help with the renewal of our homes and the world. The survival of our community and the communities we serve is at stake at this very moment. This moment could not be more profound as we move forward, and we should all embrace the opportunity. So with that, let me briefly introduce our panelists who will offer their conclusions for today's working groups. In no particular order, first we have Amandeep Gill from the Global Health Center. Welcome, Amandeep. Alongside Amandeep is Carlos Lopez of the Mandela School of Public Service. Hello, Carlos. Next, we have Jorge Martin Arturo Arguello from the government of Argentina. Welcome, Jorge. And with us, we have Maria Renska Shaki, who is a former member of the European Parliament. Good to see you, Maria. And we have Dr. Mongyoung Yen, Director of the Department of Diseases, Control, and Prevention in Taipei City Hospital in Taiwan. Welcome, Doctor.
Thank you.
I have no doubts that we will offer salient, pertinent thoughts to our many discussions today. And let me move now to give the floor once again to Jim, but also once again to thank him and to thank all of you for the great contributions that you're making to this vital cause at this incredible moment. Thank you very much. Good day to you.
Thank you, John. We'll move in the order according to the agenda. Amandeep Gill, can you start us off? Thank you.
Thank you very much, Jim, and my congratulations to all the working groups for the tremendous work they've done and the thoughtful presentations today. And thank you to General Allen for his scene setter. I want to focus on the three main challenges the implementers of these recommendations will face, and three sets of metrics, measures of success that they can keep in mind as they take their work forward. The first challenge is that this crisis has shown that the science evidence via evidence policy interface has not worked very well. It's easy to blame this on a few populist leaders, but I think there is a deeper communication problem. There's a problem of silos. There's a problem of lost in translation. For example, the guidance around wearing of masks, for example, it reflected interest of a particular community of experts. And then as the broader ramifications unfolded, you had to adapt that guidance to other interests. So this leaves leaders confused and not necessarily populist leaders. So this is something that the groups should bear in mind as they move forward. The second problem is that of fragmentation. This is not only about science and data nationalism, but it's also about the fragmentation in terms of approaches to solving problems. We've seen my app is better than yours, my epidemiological model is more rigorous than yours, and from where is my PPE to where is my COVID tracing app. So even within like-minded groups, we've seen this competitiveness, this fragmentation in terms of responses. And this is where think tanks have such a role to play in providing a safety net for the kind of collaboration that's needed to overcome this fragmentation. The third challenge that the groups will face moving forward is that leadership in multilateral organizations, in multi-stakeholder initiatives, has been less than impressive. There has been an intellectual gap, there's been this leadership deficit, there's been a legitimacy gap. So think tanks would again have to step in to do what UN organizations have traditionally done, which is to bring diverse stakeholders together across borders. So in a sense, think tanks will have to behave more like international organizations as they face the future. Now, what are the three sets of metrics that they should keep in mind while implementing these policy recommendations? The first is resilience. How does their work build resilience in different domains, whether it is the health domain or it is the sustainable development, economic growth domain? The second metric has to be around responsiveness. How responsive are the measures being suggested or being implemented to changes in the context? This is almost like what you do in digital domains, where there is real-time integration of data and real-time presentation of possibilities to policyholders. And the third metric has to be about responsibility and the accountability that goes along with presenting policy recommendations. So whatever that is being suggested, that should enhance in a transparent way the responsibility of the action takers who claim to act on behalf of others. So if going forward, we keep these three big challenges and these three sets of metrics in mind, I'm sure that the very good recommendations that are contained in the working group reports would make a difference to our world. And last word, Jim, on the kind of people I have noticed that have come together in these working groups. This is the kind of inclusive, diverse, youth-rich collaboration that we need in the post-COVID environment. Thank you very much.
Thank you very much for your comments. It's very helpful to hear your advice, and it's wonderful to see Carlos Lopez, who I've not seen for some time, and I look forward to your comments, Carlos.
Thank you, Jim. It's a pleasure to be with you. I would say that we have all been facing the three megatrends for some time: demographic, technological, and climate change. But COVID-19 crisis has brought some special features into the way we deal with each one of these megatrends. For instance, on the demographic front, we have now a discussion that goes beyond just fertility and youth boom and things like that. We have now focused much more on social protection and how aging population can be affected by a pandemic like this and how fragile the social protection systems may be. There is a return of the discussion about the welfare state by introducing more state interventions, a Keynesianism revival somehow that has been provoked by COVID-19. And obviously the responsibilities for health have become much more prominent in the discussion about global public goods. And the idea that you can just privatize some of these global public goods is becoming a subject of controversy in a number of countries. And obviously we have now a discussion on bioethics that is going to be taken from a completely different perspective as a result of the crisis. On the technological front, we knew from the US-China war on trade, that the real issue behind was probably technological, and how you position for the future with artificial intelligence, who is going to dominate on G5 technology. And obviously now we have introduced that discussion of the value chains that have been the subject of disruption during the crisis, with more protectionism, trying to make sure that there was association between investment screening and protectionism related to security, extended now to the health dimensions, has completely changed the way we are going to deal with trade in the future. And I think the crisis at WTO is just one manifestation of what is going to come to be a much more dense discussion on how you measure productivity, how you are going to rate risk, because now risk is associated with the spread, graphical spread of the value chains. So there are a number of new features that are going to enter into the discussion. And we can go as far as to say even taxation is going to be the subject of a lot of discussion, because taxation of technology is going to become an imperative, because people are going to face huge public debt. There will be a temptation to try to raise taxes. And the hanging fruit is how you basically do it with the technological firms that have been avoiding tax through financial optimization. And on the climate, you have also the same type of discussions emerging. For instance, fuel subsidies, which is one way of associating tax to promotion of fossil fuels, is now for the first time being questioned, because countries saw an opportunity with depressed demand for oil and the prices of oil going so much to historic lows, to scrap fuel subsidies, as it has happened in a number of countries, including in Africa. And this is going now to give an opportunity and a window to revisit the opportunity, the competitiveness of renewable energy much more than before. And obviously the carbon intensity discussion is also now less prominent in the debates across different countries than, for instance, the reason why virology and epidemiological speeds have changed as a result of imbalance on the way we treat the environment. And people say, well, you have COVID because the environment is being mistreated, and this is just a reflection of that. So this is going to be very interesting. Environmental stress that was already present for many regions of the world and has provoked huge movements of people, including flows of migrants out of Africa, is now also associated with other forms of repressing human mobility because of social distancing policies and fears. So you have all these characteristics, and as Amandeep was saying, you have a multilateral system that is not capable of responding to these levels of complexity. It is short of, responding with the quality and the sophistication needed.
1 minute remaining.
And this is basically introducing another element into the discussion, which I think is going to be the future of multilateralism, which is the battle for jurisdiction. Who has to decide on behalf of the others, through regulation, through taxation, through technological standards, through different ways of imposing your will to the others, not using the multilateral system but bypassing it.
Carlos is always illuminating and provocative at the same time, which is what we're looking for. I now would like to introduce Ambassador Jorge Arguello to speak to us. He is the current U.S. and Argentinian ambassador to the U.S. and the Argentinian Sherpa to the G20. Ambassador. You are mute. Yeah. Ambassador, you're muted. You need to unmute. maybe Anne can help. We still have a problem with the sound on your end. You're still muted. So Anne, can you help the ambassador, and then we'll come back to him. Sorry, we have been flawless in terms of technical glitches. It was bound to happen, and I'm sorry it happened to you, Ambassador. Can we move on until the technical glitch is resolved? Ajit, can you now speak, please? You're muted, so you need to unmute your speaker, Maria or Majid.
Oh, sorry, I didn't recognize it. Excuse me. I hope you can hear me. Yeah, wonderful. It's a great pleasure to see you all. In fact, when I think about think tanks, I should say I've really been missing a lot of the meetings, missing you all, not so much the ideas and the papers and the many webinars, but more the informal conversations that always happen during coffee or after the meetings, and where, you know, new ideas and new friendships and new relevant contacts always emerge. So I truly hope that you're all staying well, that you don't have too many worries to deal with, both personally on the health front or for your organizations and their sustainability, and that soon we will be able to meet in person again. But it's a pleasure and an honor to join you today. I've been asked to focus specifically on Europe, but as I was trying to gather my thoughts, I realized that there's quite a few tasks that I believe are before European leaders, similar to how they are before think tank leaders. So let's see whether you recognize this. I believe that the pandemic has really put us all at a moment of very delicate balancing. Balancing between making sure that what is of value may sustain. So for example, what should not be disrupted, which budget should not be cut, or which functions should not be crippled, what should not be displaced, and at the same time, how to continue to innovate. So I think we'll see this balancing act between how to maintain jobs and green the economy, for example, or how to focus on the specific new reality that the pandemic brings, while staying clear on other developments and the long term that still deserves analysis and focus at the same time. In other words, many balancing acts also between the promise of principles and how to protect them in practice and under pressure of the pandemic. And I feel like to make that promise more of a reality, think tanks may also think of themselves more as do tanks, to see how the ideas that they have could actually materialize in the real world. Because it's good to dream big, it's good to have theories and ideas, but the practice is also very important. Now let me focus a little bit on Europe, where I see some similar realities in terms of the promise of a values-based approach, one focused on human rights, on a human-centric view, for example, when it comes to technology, humane treatment of people, and a sort of humanist tradition. How to sustain the social safety net and solidarity at a time where this is truly tested, and where on the one hand we can point to examples where European solidarity has succeeded and safety nets have really proven their value. We must also be honest and see that a lot of trust has been lost, and look at how that could be regained, or how it could be explained that it is lost. I predict there will be some new dynamics, not only in the fields that I focus on, technology, artificial intelligence, and questions of tech policy, how the EU will mature and widen the scope of its intervention to make sure that the rule of law is leading, and that there's not privatized governance of everything digital. And I truly hope that the pandemic does not distract European leaders too much. There's been clear charm offensives by big tech platforms. Tech companies have been able to move into areas that were no-go before. Think about health, think about education. And so the question whether Europe can continue to build its role as a values-based actor building new alliances where I hope a democratic model can be formed will be a test that the pandemic really puts into the spotlight. And clearly bridging the technological and the geopolitical is something to look for as well. And I think that really ties in with questions of how strong new and maybe revamped nationalism will emerge at this moment in time, where no doubt during next waves of elections, nationalists will try to share an alternative vision than one where mutual dependence is recognized, where mutual responsibility of solving problems across borders is sustained. And so I'm very curious to see how an international rules-based order will fare in light of increasing pressure, and also pressure on a lot of the established parties that have had to weather this pandemic storm. So hopefully the litmus test will work out well for Europeans, where they can turn values-based promise into practice, build new alliances all over the world, and find new ways to govern capabilities like technology. So in doing all this, I feel like there's one more thing I would like to share, which I'm very much reminded of every day that I spend online in my new world and new country, the United States, is that this is particularly an important time to assess who is not at the table, to understand what constituencies look like for think tanks and politicians alike, to make sure that unheard voices, whether it is ideas that may not be recognized as valuable or people's lives that are impacted by policy decisions and whose voices need to be heard, should really be brought to the table. And so I hope that at this moment of broad reflection, deep reflection, and a huge confrontation with everything we take for granted through the pandemic may also lead to sparking of more inclusion and creative ways of making change. So I'll leave it at that. I'm happy to answer questions if that's possible, or to engage with you individually in the future. Thank you for including me, and have a great rest of the event.
Thank you very much. We will encourage, not only for the working groups, but for the featured speakers, for those in attendance to pose questions, and we will share those questions with you. Unfortunately, in this very crowded, rich, and full environment and limitations of this platform, the Q&A is, I think we're already at the extreme edges of our tolerance in terms of the participants. So the format does not really provide, and time does not provide for Q&A, but I encourage everyone to use the Q&A function on this platform. We'll try once again. Ambassador? All right. Yes. Ambassador, we're still no sound, unfortunately. So I'm not sure. We'll go to the final, and then hopefully someone from CG can call the ambassador, and Gustavo, if you can provide the number, so we can work with the ambassador to hear his interventions as the final speaker in this segment. I'd now like to introduce Meng Yongyen from Taiwan, who will talk about, as we've heard others reference, how they beat COVID and have remained open.
Okay, thank you, Jim. Can you hear me?
Perfectly, thank you.
Okay, thank you, Jim. Thank you for inviting me to attend this great meeting. So next slide, please. We all know that the COVID pandemic has swept the globe and caught many countries off guard. While Taiwan has a population of 24 million people, has managed to limit the spread of the diseases. There are only 47 cases and 7 deaths up to now. So how was Taiwan able to prevent the spread of the COVID-19 virus? Next, please. So lesson learned from SARS was most important. Taiwan was poorly prepared when SARS struck, and it attacked hospital and healthcare workers. while in 2009, H1N1 pandemic was spreading at community settings. So learning from these devastating impacts, policymakers developed the following strategies so we can take prompt and decisive action to confront the COVID-19 crisis. Next slide, please. So the first would be a hospital infection control strategy. We all know that we have a surveillance system, and then we improve the hand hygiene campaign. And most importantly, we had an annual inspection and on-site audit for hospital infection control program. But above all, traffic control boundary, next slide please, was most important. We developed the traffic control boundary strategy during the height of the SARS epidemic. It was composed of triage before hospital and zones of risk inside hospitals and checkpoint alcohol hand disinfection while in between zones. So by clear delineation of zones of risk and hand disinfection, we successfully eliminated droplet and formal transmission. Next slide, please. So by implementing traffic control boundary nationwide hospital, we eradicated SARS in 2 weeks. Next slide, please. So the next strategy would be systemic renovation for pandemic preparedness to integrate public health and healthcare system and promote state society cooperation initiative, which has these three components. Next slide, please. The first one would be incident management system, where the Central Epidemic Command Center would take the lead by centralizing the big data to produce policies and regulations through science and data-driven adaptability. We manage the crisis quite well. The second one would be a communicable disease control network. So starting after SARS, those experts from hospital, public health, local health departments, and the Taiwan CDC were recruited to work under the coordination of a medical director to manage issues like surge capacity of human resources, isolation, hospital network, and resources allocation. Next slide, please. So the Taiwan, next slide, yeah, the Taiwan had been divided into 6 communicable disease control network. Next slide, please. The third one would be crisis management with 2P and 2R. The first 2P was prediction and preparedness. With the prediction, actually, we always stay alert with risk assessment. That's why we had an early deployment to combat COVID-19. And with the surveillance during the preparedness phase, we had capable of early detection, the first case. Next slide, please. For response, of course, we are focusing on leadership and communication. We have a powerful commanding center, is all right. And for the communication, we have transparency and public education through various channels and rapid response to rumor to build trust and support. And for containment and mitigation, we had a strict quarantine and IT tracking system to curb the spread of the virus. As for the recovery, it's a process of continual quality improvement and then go back to the cycle of 2P2R, go back to prediction. So the system has been repeatedly activated and boosted through various epidemics, which has kept Taiwan improving in pandemic preparedness along the way until now, COVID-19. Next slide, please. So up to now, we are based on research and best practices at hospitals with new public health practices were introduced, including hand sanitizers outside of most public buildings and protective masks. At work and schools, students and workers were required to have their temperature taken and wear masks all the time if social distancing is not possible, except at lunch. Next slide, please. Face mask. Next slide, please. And as we all know that, next slide. The droplet transmission would always follow by formal transmission. So when knowing the pre-symptomatic transmission character of COVID-19, we enhanced our traffic control boundary to cut off the community hospital community transmission cascade. In that way, we can secure hospitals, protect the healthcare workers, and finally preserve the community. Next slide, please. This figure shows Taiwan in the middle had a limited community spreading of virus when compared with Hong Kong and Singapore during the challenge of students returning from Western countries in this March. Next slide, please. And this is the following slides would be, next slide, please. The hand sanitizers outside of the most public buildings as a checkpoint of hand disinfection. The middle one would be that example in Africa. Next slide, please. And this is how we demonstrated in website for foreigner visitors from airport to protect from formalin transmission in the right way. Next slide, please. Last one, okay, face mask is equally important as well. And this is a complicated figure. However, we have strong border control to limit the spread of the virus into Taiwan. This is the outside circle, okay? And for those virus sneak into community, there are face masks and hand sanitizer interrupting its transmission. Of course, there will be always leaks with low-grade community circulation. But then we're counting on the last defense of healthcare system through Six Sigma enhanced traffic control bundling. So without these measures, we can only go in between lockdown and reopen and perhaps lockdown again. Next slide, please. Yeah, next slide, please. So an ounce of prevention is worth a pound of care. Prevention measures can be life-changing and life-saving. Also, our example demonstrates that effective pandemic responses requires a resilient government willing and able to adapt policies and engage the population in response to changing conditions. Avoiding lockdowns, Taiwan's approach is a low intervention, low cost example for countries as they open up. And that will be my report. Thank you.
Thank you very much, Doctor. It's illuminating in terms of the steps based on the tragic experience with SARS and H1N1, but the whole value is in terms of the response. And as an example, as this whole experiment with this format is, we have crisis intervention in terms of to get the ambassador back online, and I hope that he is now able to participate and be our final speaker in this segment of the program. Ambassador?
Okay, let's try. Can you?
Yes, we can.
Good, good. Yes, you can.
Crisis management has worked.
Thank you very much, Jim. I'm very glad to be here. And thank you very much to the Pennsylvania University too. You have asked me to talk about how the G20 can help the world respond to the crisis. So I will start by saying that the global financial crisis of 2008 left us some governance-related lessons that we should heed during the current global shock. The first one is that the response to the existing global problems should be global, should be coordinated and swift, and sustained actions should be applied. In 2008, that experience proved to be decisive for the actions taken by the G20 at the level.
Pedro da casa e a Monique não. Então...
Klaus, you're online. Please mute your.
In 2008, I was saying, global coordination was possible because there was political will. Vital leadership facilitated taking quick actions at a global level. The systemic crisis generated structural responses. That new G20 governance body vindicated the multilateral system. Today, 10 years later, and when we face a global health crisis, we must reclaim and once again implement the same lessons we learned from 2008. However, considering the economic impacts of the health crisis, the initial global response to the pandemic was different from the one adopted in 2008. International political will is fragmented. Instead of partnering each state reacted on its own and continues to do so, for example, in the search of a vaccine. Isolated and even confrontational leaderships delayed what could have been a united reaction. The possibility of a cohesive response was neutralized. By what? By the priority that each state gave to the local impact of the crisis according to their respective material possibility. At a historic low point in multilateralism, the WHO, a key organization in this emergency, was called into question, and this undermined its actions. Therefore, from now on, it is essential to pursue the progress in governance already achieved and take advantage of the options offered by the G20. The G20 understood that financial and economic crises were only one part of the agenda. And that is why it's expanded its agenda and included, for example, the health of the planet, and with it, the health of its inhabitants threatened at present by the pandemic. However, after revising the initial mistakes and considering the achievement made so far, this crisis demands that global governance should once again be reconsidered. Today, as in 2008, the G20 can become a great antidote because it is an appropriate platform to create cooperation networks among health authorities composed of international organizations, to share experiences and information on measures which have proved effective, to establish commitments to ensure the availability of test kits, ventilators, etc. All this is key if we wish to mitigate the spread of the virus. Far from being paralyzed, as happened with a large portion of the multilateral system, the G20 continued even virtually with the agenda of the leaders, Sherpas, and affinity groups. However, so far, the scenario raises a series of unavoidable questions. How to give multilateralism a renewed legitimacy, which is essential for the need of people. How to include the private sector in a battle where the state is at the forefront of any coordinated effort, while it still needs a robust support to benefit all. How to turn changes in the work environment and the digital economy into a real potential for development. How to recalibrate the trade circuits without falling into binary protectionist practices that led us towards a reluctant globalization. How to level the economic playing field for developed and emerging countries. And above all, how to readjust governance in a world in which every roadmap for economic recovery conspires against political stability. In major crises, no one can save only themselves and disregard the rest. This pandemic will not be solved if any country that opens its economy increases contagion and puts the rest at risk. We are navigating in an unmapped ocean. We need to calibrate our compasses. Thank you very much.
Ambassador, thank you for your endurance and staying with us throughout, and for your wonderful comments and suggestions as we move toward what will be, without a doubt, the most important G20 meeting, certainly since 2008, but certainly if we go back to the post-World War II era, we have not faced such a crisis, and the meeting of key countries in the world is essential, and I appreciate your comments. I want to thank everyone from around the world who participated in this extraordinary event that, as I said at the outset, demonstrates that international cooperation, coming together of a diverse, politically, ethnically, regionally, diverse set of individuals and institutions to make a difference, to respond in a rapid way to the crisis that we face, this unprecedented crisis. And I would suggest that we are entering the age of uncertainty, and we need to fasten our seatbelts, but we also need to stiffen our resolve and make sure that we respond and adapt. It's clear to me that those institutions, whether it's business or government or think tanks, those that are agile, those that are responsive, those that are innovative, will survive and be able to help us through it. Those who came late to understanding that we are facing an existential crisis, those who came late to understanding the importance of technology, still have time, but they need to move fast and to learn from others, and that is this sharing experience. And together we can beat this, and it is important that we work together and continue to cooperate and sustain this wonderful effort into the future. So thank you all. It's incredible that you have all stayed with us for the 2 hours, and even more so that we have survived our own crisis and in terms of are still on time and have 4 minutes left. So I want to thank everyone, and please join the working groups next week, which are designed to give a fuller briefing of the recommendations of the 5 working groups that we could not give in this format, and to engage with a purpose, to essentially help inform further the reports of each of the working committees, but more importantly, to essentially move it toward implementation at the national, regional, and global level. So thank you all, and I appreciate it. And this is, as I said, a real manifestation and demonstration that cooperation is alive and well. Thank you all, and goodbye.